Hey everybody, we're going to introduce a new little subtopic called Real Talk with Dr. White. So today's topic comes about after I had a nice conversation with actually a registered nurse this morning about the different types of medicine and healthcare providers out there, and honestly how kind of we're all coming together and bridging a lot of gaps, especially in the Treasure Valley. So she had mentioned today that she had never really seen a chiropractor, and I said, well, have you ever seen a doctor of osteopathy? And she goes, well, I don't really know what that is, but I know that it's a DO and I know that they work in the hospitals. And so here's an interesting kind of fun fact. Osteopathy and chiropractors came around about the same time in the late 1800s. And we both had very similar philosophical approaches to the way we treat patients. Osteopaths, or doctors of osteopathy, believe that the blood flow controlled everything in the body, and chiropractors believe that the nervous system controlled everything in the body. And then medical doctors believe that kind of everything was systemically related and was a systemic disease. So I'm not going to try and butcher this thing and not really summarize too much, but that was kind of the foundations of it. And ironically, osteopaths did a lot of manipulation like chiropractors did in the early years, and they still do to this day. In fact, we have an osteopathic school in Meridian right now that ICOM that's training osteopathic doctors every day, and they still do teach manual manipulation, which is a really important thing. But osteopaths kind of followed the medical directive and started going along with the medical community a little bit more and do a lot more medicinal things, and oftentimes are mistaken as medical doctors or taken as medical doctors. I don't know if it's mistaken, but maybe just taken as medical doctors and not really identified as osteopaths, where chiropractors definitely stay more natural. So in any case, in summary, we're all healthcare providers. We're all trained in diagnosing. There are good and bad doctors across all fields. I would say that the chiropractic profession is coming a long ways as far as getting some of the quackery out of the profession and sticking more with science. And that's definitely what our clinic bases tries to do as well, is sticks to the science. We're really good at diagnosing. We have a lot of diagnosing classes. We go to school for 8 years. People don't realize that chiropractors go to school for 8 years. I have an undergraduate degree in pre-medicine with an emphasis in biology and genetics from Texas A&M University, and then went to another 4 years of school. The osteopaths do the same thing, and then they can go on and specialize obviously in surgery and internal medicine and so on and so forth. So they definitely go to school for a lot longer once they kind of go through their specialties. And they have a lot of training in their residencies as well. Our residencies built kind of into our schooling. So in any case, here's some of kind of the similarities, but we all have a lot of education, and she had no idea about that, and I did realize that maybe a lot of other people don't as well. So just a little segue into that. I think we'll be talking a little bit more about this in videos to come. Have a great day.